What were the economic predictions for the ACA's market impact? The Affordable Care Act, often known as the ACA, was designed with several economic predictions in mind that aim to reshape the health insurance landscape and the overall economy. One of the primary goals was to expand health insurance coverage. The ACA aimed to reduce the number of uninsured Americans significantly. The Congressional Budget Office projected that by 2019, around 32 million people would gain health insurance, which would enhance financial security and protect individuals from high medical expenses. Another key prediction was related to the labor market. The ACA was expected to change how people approach their jobs. By providing affordable insurance options outside of employer-sponsored plans, it aimed to reduce what is known as job lock. This term refers to the situation where workers feel they cannot leave their jobs for fear of losing health coverage. The CBO estimated that by 2023, about 2.5 million individuals might leave the labor force, often to retire or pursue self-employment. This flexibility was anticipated to encourage more diverse employment choices without negatively impacting overall job numbers. The ACA also aimed to slow the rapid growth of health care costs. By implementing reforms like reducing excessive payments to providers and promoting value-based care, the ACA sought to ease the financial burden on both employers and the economy. Early data suggested that, after the ACA was implemented, health care spending growth rates dropped to historically low levels. This slowdown was expected to support wage growth and job creation, benefiting the economy as a whole. In terms of economic stimulus, the ACA was predicted to boost demand for goods and services. By expanding coverage and reducing financial insecurity, it was expected to stimulate economic activity during a recovery period. The CBO estimated that the ACA would reduce the federal deficit by $109 billion from 2013 to 2022, highlighting the cost savings and revenue increases from the law's provisions. This stimulus effect was anticipated to lower unemployment rates and support economic growth without hindering job creation. The ACA's marketplaces were another critical aspect. These were designed to provide affordable insurance options with subsidies to encourage more people to enroll. Enhanced subsidies, which were later extended, were expected to increase enrollment and lower premium costs for many consumers. This would stabilize the insurance market and improve affordability for individuals and families. In summary, the economic predictions for the ACA's market impact included expanded coverage, more flexible labor market choices, slower growth in health care costs, and positive economic stimulus effects. These predictions suggested that the ACA would not only support a healthier insurance market but also contribute to a stronger economy. While actual outcomes have generally aligned with these expectations, some coverage gains have not met initial projections due to various policy changes and other factors.